And so then the question is, why are you taking steroids or TRT? I don't do that. I've competed my whole life as a drug-free athlete. I've been an adamant opponent to drug uses, particularly in sports that say it's not illegal. And when I was competing in powerlifting, I competed in USA Powerlifting, which is probably the finest powerlifting organization in the country, if not the world, as far as at least trying to implement a drug-free policy.
Shawn Baker, Natty or not, carnivore tribe, yay yay. What's up y'all, Red Pill Vegan, and I'm about to trigger some vegans by making the case that Dr. Shawn Baker is full natty as a lifetime natural athlete. You'll see the facts for yourself, then the only question left is, where does your boy get his protein?
A T-bone steak, cheese, eggs, and a T-bone steak, and a T-bone steak.
Alright y'all, first things first, watch the whole video and you'll get the real story, because there are some points of contention here. The furthest back in time I could dig up anything about this man on the internet was this article from 2007. Before I start dropping the hard evidence on natty or not, I just want y'all to appreciate Dr. Baker's sense of humor. Upon returning from what was undoubtedly a gruesome tour as a surgeon in the Afghanistan war, he remarked that one of the highlights was the lack of insurance pre-approvals and paperwork involved with the routine care in the United States. If the great man theory carries any weight, Dr. Baker is a perfect illustration of how a natural alpha can use charisma and intelligence to shape the world around him. You don't just pull an all-meat diet out of your ass and expect tens of thousands of people to follow your example. This brings us up to 2008. Here's another official military publication highlighting his accomplishments in the sport of powerlifting. The article lists him as 6'5", 260 pounds, and shows a picture of him shrugging 765 pounds. That's 8 plates on each side. The article quotes him as saying that he's been lifting for 27 years, starting at age 14, and powerlifting since 1988. At his last competition, he pulled a 711-pound deadlift, breaking a record for his class. He is also on the record in this article way back in 2008 talking about how he only competes in organizations which test the competitors for drugs because of the difference it can make. It's clear from these articles that we are talking about a man who has tremendous momentum with his health and strength. Essentially, elite level fitness going back at least 2 decades. Keep watching because we can further corroborate this time frame and the facts. Fast forward to 2009 and his career as a drug-free lifter and record setter, including a specific mention of his best ever 772-pound deadlift in the year 2000. This is almost 20 years ago, y'all. Here he is in a recent interview recalling these details as they occurred almost exactly as they are preserved in the historical record.
And then I was, civilian for a while. I continued doing sports. I competed in powerlifting. I mean, I was decent at the deadlift. I pulled a 772 deadlift as a drug-free lifter at I think it was 275s or whatever. I think I was probably 280 when I did that. I always competed. I know you compete in USAPL. That's where I compete. I compete 80 FPA before that, and then I did stuff in like WABDL and then NASA, which was these are all tested organizations. That was my thing. But
Again, here he is 10 years ago advocating people stay natural and stick with lifting. Now, one point of contention that could be made in this natty or not discussion was his recent blood test where he had unusually low testosterone levels. This has been pointed out on YouTube in other videos analyzing his blood tests in detail. Some people on my channel have even stated they think it's obvious that he's on anabolic steroids. However, Dr. Baker has an explanation for his low testosterone levels. Stick with me through this next clip as I've pulled this full clip from a longer video where he explains his low testosterone levels.
And this is another topic. A lot of people, it's kind of funny because people accuse me of being low testosterone because of my lab test, my testosterone was low on one test. Again, that shows you what was happening that day at that given second. I mean, obviously, I'm not lacking for muscle mass. I'm not some, Dr. Grieger lookalike. It looks like the wind would knock him over, quite honestly. So, I mean, your testosterone level varies day to day, minute to minute, hour to hour. We know that's true. You can repeat it a week later, it'll be different. And indeed, I repeated it a week later, and it was within normal range. It was low normal, but still within normal range. Again, there was this nice paper that came out out of McMaster University this year. Stuart McGill and some other people were authors on the paper, and it showed that in resistance trained young men, the most important factor for muscle growth was not hormone level, it was androgen receptor density. And I've talked about that many times. If your androgens are more dense, if the receptors are more dense, you don't need as much hormone, okay? What things increase androgen receptor hormone density? Compounds in meat like carnitine, right? Intermittent fasting or time restricted eating, or eating infrequently, which is what I do. I eat meals once or twice a day typically, sometimes 3 times a day, but I don't eat a bunch of snacks. Exercise, resistance training, I do all those things.
I'll be interested to hear y'all debate the merits of his explanation for low testosterone in the comments section on this video, but please keep it civilized. Some interesting information that I think is relevant to the discussion comes from this tweet by Dr. Rhonda Patrick. Older individuals in their 70s that exercise for 50 plus years had skeletal muscle metabolic fitness that was indistinguishable from those of active people in their 20s. The active elderly group had cardiovascular health that was similar to people 30 years younger. Here's the study. While the study was not specifically on older powerlifters, the point I'm making is that Shawn Baker has maintained an elite level of fitness for most of his adult life, and definitely on the record for at least the last 2 decades. Your long-term approach to health and fitness is going to have a huge impact on your lifestyle later in life. I'm not going to try to make generalizations about his other blood test results and his overall health, because I think that falls outside the scope of this Natty or Not video. And other people have already covered that in a way that will at least make you question the carnivore diet, and hopefully do some more research to follow up before making dietary choices that can have a significant impact on your health in a variety of different ways. The point I want to make here has to do with the concept of health momentum. Prior to the rise of the carnivore diet as a social media phenomenon, Shawn Baker had tremendous health momentum. To me, it looks not only plausible, but documented that he is a natural lifter. If you disagree, then let me know in the comments why you think he's on gear. I think we can all acknowledge he's obtained legendary internet troll status. Legendary internet troll status. He's hilarious. He demonstrates amused mastery and frame control in a way that most men will never embody. Frame control and amused mastery are red pill concepts that simply serve as models of masculine behavior in a much broader context than any debate on diet or steroids. If you'd like to see me do more content about social dynamics specifically, then let's talk about it. But for now, I'm asking the question, is someone's diet alone a good enough reason not to like somebody? For me, it's hard not to like Shawn Baker. I'm sure he works hard, doing lots of things many of us take for granted. So what do y'all think? Dr. Shawn Baker, natty or not, Based on the artifacts I dug up out of the historical record, I'm saying his history has proved authentic. This man is a lifetime elite level athlete and natural power lifter. If you want to present another case or some more evidence, then be my guest. But the bottom line is, look around, man. This guy didn't just sprout a six-pack and a pair of muscles at middle age. He's been in shape his entire life. He has tremendous momentum with his strength and with his health. You can't take that away from him. So, with that being said, if you are concerned about the health effects of the carnivore diet and the science behind it, I have set up a playlist with several in-depth videos. Make sure to hit that subscribe button and click the thumbnail to take you to the carnivore diet playlist at the end of this video. Y'all know what time it is. Red Pill Vegan. Next.